Welcome to EMS Office Hours. This is Jim Hoffman, and we're going to be continuing on with our EMS quick study tips and neurological emergencies, and specifically coma and altered level of consciousness. And as always, I ask that question, why is this important? And of course, I always say it's important not just for exams, where it's giving some key content for what you'll see on exams, but also for things like your patient care. Helping you sort of figure out what's going on with your patient and to transport and treat them appropriately. It's also great for when you're doing your documentation and when you're interacting with other healthcare professionals. Now, we talk about some of the assessment and the causes, and we look at AEIOU and tips, right? And we talk about A for acidosis or alcohol, and E for epilepsy or endocrine issues, and also infection for things like sepsis, right? And we'll talk about overdose, thinking about the patient's medications or an overdose of some type. And also things like uremia or trauma, right? Especially head trauma. And then our insulin for those diabetic patients, and maybe that's causing the coma. Or psychosis, shock, and stroke. Okay, different, especially for stroke. And what are some of your key findings? We'll talk about patient assessment when you're assessing these patients. We want to find out, when was the last time the patient was seen well? What was the onset of the symptoms, and how did they progress? And what were the symptoms that might have preceded that onset of the coma, just prior to the coma? Think about drug use, even overdose on prescription drugs. Look for evidence of trauma, like I said, especially head trauma, your pupil response, and your blood sugar. And our management, of course, is airway, oxygen, and vital signs, as always. And we're also thinking about things like starting an IV, transporting this patient appropriately, and watching out for vomiting, especially for head issues, right? Brain issues. And, of course, get an EKG and reassure that patient, guys, because even stroke patients can still hear what's going on, even though they might not seem to. All right, I hope you've enjoyed these Monday Minutes. I hope you can use them in your studies and in your day-to-day EMS activities. If you've got some minutes of your own, I'd love to hear them. Send them over to me with your comments, concerns, or suggestions. Again, I can create Monday Minutes based on something that you want to see here on these episodes. So my email is contact@emsofficehours.com. And be sure to go ahead and connect with me as well, guys. I'm over on Facebook, Twitter, and YouTube, all at EMS Safe is my username on all those platforms. So hopefully I'll see you there. All right, that's it for me. As always, Jim Hoffman for EMS.